When did that?
That's what you're saying.
5 minutos más. You don't need more than 5 minutes. Here you go. Here you go, Donna. 1 minute.
At the end of the day.
Is this connected to the?
Good afternoon, and thank you for joining us for this afternoon's session of patient engagement, a key strategy for improving the quality, safety, and experience of care in your organization. My name is Donna Thorson, and I would like to introduce our speaker today, Libby Hoy. As a mother of 3 sons living with mitochondrial disease, Libby Hoy has 20 years of experience. I'm trying to change the slide, it's not working. 20 years of experience navigating the healthcare system. Ms. Hoy began volunteering as a parent mentor in 1995 and has been working to improve health systems and empower patients and families to be active partners in care ever since. In her role as the first family advocate at Miller Children's Hospital, she developed the Parent Advisory Board and created the structure for the long-term integration of the patient and family voice within the organization. Ms. Hoy has presented at multiple national and international conferences on subjects related to patient and family-centered care practice. As a consultant, she strives to share the evidence, practices, and methods that support patient family-centered care culture in healthcare organizations. In 2010, Ms. Hoy founded the Patient and Family-Centered Care Partners to create a community of patients, families, providers, and healthcare organizations committed to the shared learning of patient and family-centered care practice. PFCC Partners also established the PFA network, inclusive of more than 150 patient family advisors working in healthcare settings across the country to partner for improvement in the quality, safety, and experience and delivery of healthcare. Libby has served as an advisor to Patient-Centered Outcome Research Institute, Partnership for Patients, Institute of Medicine, National Quality Forum, and as faculty for the Institute of Healthcare Improvement. In these and all efforts, she strives to build the infrastructure and capacity for healthcare organizations to engage all patients and families from the bedside to the boardroom. Please welcome Libby Hoy.
Good afternoon. I'm just not going to touch anything. I have a little PTSD from the last session, but we're good. Anyway, I just really want to start out by thanking so much Health Insight for having me here today. I just thoroughly enjoy my work with Health Insight. I think it takes a degree of humility along with a degree of boldness to create improvement in healthcare, and I don't know anybody who lives their mission more than Health Insight, so thank you so much for having me here today. And thank you for that nice introduction and the slide. No? Okay. Okay, how's that? Better? Okay. In 2010, I did found Patient and Family Centered Care Partners, and we are a community in Los Angeles, California, Long Beach to be specific, of healthcare organizations, patients and families, clinicians, everybody all in the same organization working to co-design solutions. We really believe that if we get all 3 of those cogs working together, then that's the way we'll design solutions that work for all 3 of those stakeholder groups. I know those are large buckets, but I'm sure that each of you sort of can see yourself in each of those areas. I've been surprised over the last 6 years now that we've been in existence. When I started, I was focused on hospitals, and I think most of our patient family-centered care work and engagement were focused on hospitals, and that's really exciting to say that is no longer true. We're working with quality improvement organizations, quality improvement networks. We work with the National Coordinating Center for Quinn QIOs, who we're just getting to the back end of creating a patient family advisory council for the National Coordinating Center. That's remarkable, and that's an important message as you're all thinking. Sometimes I have conversations with folks and they say, well, we don't have direct contact with patients and families. If you're working on healthcare, you have direct contact with patients and families. Whether you're touching them or whether the policies and the programs that you're designing are being implemented, and this is all, patient family engagement is all about reconnecting with that touch. This is a bit about the way that PFCC Partners works. We work on the community level in creating the conversation and creating the platform for the conversation. We provide some skills development pieces around implementing patient and family engagement. I still personally work in the role of a patient family advisor and partner with some of the organizations listed to actively bring the patient and family voice to those projects. However, my bigger goal, my bigger vision is always to make room in the healthcare environment for every patient and every family member to have voice in it. It's not about me. It's not about, we heard the term professional patient a couple of, in the last session. It's not about that. It's about creating space in the environment for all patients and families to have voice. So we'll look today about how to recognize patient family engagement, not as a model or a noun, but as a really active strategy for improvement. We'll also look at what successful patient engagement looks like and hopefully walk away with 3 action items that you can initiate in your organization. Because patient family engagement, while it may, CMS is now mandating that it's part of their contracts, you know, IHI is promoting it as a key strategy. The hospital engagement networks did so. All of this great work is going on. We know that it gets implemented locally. The culture shift happens in the communities, in the healthcare organizations, and that happens because each individual commits to it in that organization. So I wanted to share a little bit about why I'm so passionate about patient family engagement and why I think, why I know it works. It works in our family. It has worked for more than 20 years in our family. This is my oldest son, Stephen, standing, the taller one standing outside, Nicholas next to him, and baby JT in the incubator. All 3 of my sons live with mitochondrial disease, which is a cellular level disease that affects the body's ability to transfer food to energy. Between them, they've had 29 surgeries in 13 hospitals across the country. They've had hundreds of hospitalizations, outpatient procedures, thousands of therapy visits. We're that high-end user of healthcare, but we've learned a lot about how healthcare works and sometimes how it doesn't work. What I'm really focused on is the fact that as we learned, we were so fortunate to have a wonderful pediatrician who took a team approach to the care and really brought in our 7 specialists and helped us to sort of organize. And with her working as the quarterback and us being the center, we had our offensive line, right? Ready to go, ready to work for us. And all of our specialists, our therapists, our whole team. Okay, and that's the value of that cannot be understated in the outcomes for patients and families. This isn't just about feeling good, even feeling empowered, although that's my favorite part. It's really about better outcomes, using lower resources, okay, for a definite, better, healthier community. That's the triple aim. Our family represents that triple aim. These are some of the outcomes in the making. That's Stephen playing rugby at the University of Denver, despite having 70% lung function. He runs a lot at Denver. Stephen has 2 rods from T3 to T12 in his back and 14 screws, and another rod from hip to knee. He doesn't look too terribly, concerned about all that right now. And by the way, his orthopedist approved this. I could have killed him, but anyway, he approved this, right? And you'll notice a lack of other white jerseys around. He's a pretty empowered kid, okay? He doesn't just see himself as someone living with mitochondrial disease. He sees himself as a student, as an employee, as all of these things. Nicholas is next to him. We were told when Nick was 3 years old that he was mentally retarded and would never walk distances without a wheelchair. That's him as the starting goalie for the Junior Pan Am Games a few years back. He played for the U.S. junior national team. Water polo is a really demanding sport, and he doesn't have a lot of energy. He has 60% lung function, so he couldn't play the field. But he has my really long arms, and so he made a great goalie, okay? It's about seeing yourself as something more than just your disease. That's the impact of engagement, of empowerment through the healthcare environment. By the way, Nick was fed by G-tube until he was 14. That's him at 17. JT is down there in the corner. He's the youngest member of the Long Beach Search and Rescue unit. Despite 5 years of living with chronic seizures, he has done incredibly well through school and just started college and also plays water polo at Cal Lutheran University. So it's not just about feel good. It's not just about, HCAP scores. Anybody familiar with HCAPs? Anybody? Anybody have nightmares about HCAPs at night? Okay. It's not just about feeling good, it's about improving outcomes. So why now? Why are we here talking about patient-family engagement? Because CMS is driving it. They're mandating patient-family engagement in your lands, in your work, right? But they haven't given a lot of how-tos, and so that's what we really want to talk about today. But CMS is in good company. You know, it's a journey, right? This is a different way to do healthcare, and that's okay. If we can all embrace that and be as bold and humble as Health Insight is to move forward, imagine what we can do, okay? There's a lot of resources developing. When I first started on the Parent Advisory Board at Miller Children's Hospital in 1994, nobody was talking about this stuff. Some of the pediatric hospitals, but not all of them even. And it wasn't really what I would call an integrated patient-family advisory council. It was more of a token, kind of aside to not aligned or integrated. Now we have all of these resources, the work out of the Moore Foundation around the roadmap to patient-family engagement, an incredible resource. The Institute of Medicine has developed the Patient-Family Advisor Leadership Network and created a compendium of resources around patient-family engagement and patient-family advisory councils. The most important thing is that we're talking about patient-family engagement as that blockbuster drug of the century. Has anybody heard that before? No? Yeah? I like it too. But I also like this gentleman, Leonard. I've never met Leonard, but I thought it was a great quote because what he's acknowledging is that it's difficult, right? It's like he's likening it to a restaurateur who needs to provide a fantastic in-restaurant dining experience and also teaches clients how to cook. It's a good analogy, right? It's difficult. This is not the way our medical staff was trained. Our clinicians were trained, okay? But to be a blockbuster drug, let's think about drugs. When I take a drug, it does what? It catalyzes a change, right, of some sort. Patient-family engagement has that same potential. It's a catalyst for change. It's an active strategy for improvement, no matter what you're trying to improve, whether it's the patient experience and raising those HCAP scores, or whether it's a quality improvement program or an improvement in the safety of healthcare. It's an active strategy. But it's challenging, right? I love this cartoon. Who wants change? And who wants to change, right? That's the reality of our healthcare workforce. It is a challenge. And I think I really want to encourage each of you as you move forward with patient-family engagement to take a minute and acknowledge that. Acknowledge that our healthcare workforce was trained in a different way and that we're now asking them to move towards engagement as a strategy. I think that they'll find it really helps them reconnect with why they went into healthcare in the first place, because it brings back that human feature again. I really believe that most people go into healthcare because they want to improve other people's lives. I think that's a pretty powerful motivation to tap into. But I think we put in EPIC and we put in HCAPS and we put in HIPAA and we put in all these other things, right? And it gets in the middle of that connection. And that's sort of where we go astray. So I think we need to acknowledge with our healthcare team that this is a different way to do work. And then ask them, I had a really smart professor one time tell me, always ask people what they've done before you tell them what to do. And in my life, that was so important. You know, in raising the kids, I wanted a physician, ask me what you've done before you tell me what to do. Don't tell me how to change the G-tube. I've already done it 20 times. It sets up a more respectful relationship. We need to do that the same thing with our healthcare staff members. So I'm kind of a simple girl, so I've distilled down to 3 words. These really important and deep definitions. You can go online and find a lot of really good definitions for patient-family-centered care, for patient-family engagement, and patient experience. For me, and in our talk today, our time today, I just wanted you to know how I think of it. I think of patient-family centered care as the model, the culture we're trying to move to. We're trying to move healthcare into a patient-family centered culture, right? So it's kind of that model, the noun. Patient-family engagement is the active strategy of how we get there. Does that make sense? Okay. It's the invitation, it's the interaction, it's the co-design, all right? And patient experience might be one outcome. Maybe it's a quality outcome, maybe it's a safety outcome, okay? But we're using that strategy. And I think it's also really important, one point I was supposed to make on the last slide that I forgot, I'll blink it now. I think it's really important to set our expectations for staff and let them know, you know, we're not necessarily moving towards happy patients. You know, we went on a Hawaiian vacation a few years back, and we got to the hotel and we were so excited, and, you know, got the surfboards, got all the fins, just ready to go, right? 3 years ago, I walked in with Nick and Steve into the hospital emergency room because they had the stomach flu and we can't manage that at home by ourselves. I was pushing Nick in the wheelchair, and I had Steven slung over my shoulder and I'm the shortest one in my family, and this was just a few years ago. So you can imagine what that whole scene looked like, right? How in the heck are we going to have our staff members expect them to move us to happy patients? I'm not sure that that's really realistic. Okay, something to think about, and we'll talk a bit more in just a minute. Oh, okay. I'm getting accustomed to the polling thing. I think it's great. So I just want to kind of take a temperature of the group and see, you know, where are you with engaging patients and families in your work? Do you feel confident about it? Are you, you've heard of it before, but not really terribly sure? Or is this just totally new territory for you? So if you could take just a minute and answer that poll, that would be great. I can go forward now? Okay. Are the people on the webcast voting? Oh, okay. All right. Okay. Is that better? Okay. Oh, it's populating up there. It doesn't populate on the screen. I'm sorry. All right, so I think that's actually what we see most often when we talk with organizations, especially when they're, you know, a bit removed from that clinical relationship. And I love the confidence. That's awesome. That just took off. Wow, fantastic. So those of you who are feeling confident, please share with those of your colleagues who aren't, because this is hard work. And I just really believe very strongly that safety and patient engagement are two areas of non-compete across healthcare. Okay, this is hard enough doing it on our own. Let's get together in forums like this and share those best practices. So what does success look like? You know, we used to have care that was done to people, right? I remember my mom going in, you know, it is so weird and ironic. The other patient speaker, she was the youngest of 9, so am I. And I took care of my mom as she was battling breast cancer. But I remember during those years of caring for her, which was in the late 80s, that people would come in and do things to her, and they would never say what they were doing. And I remember my mom one day saying, Libby, why don't they just tell me what they're doing first? Then I could maybe help, or I could, you know. And so we've moved from that. And then we started kind of looking at the patient experience and starting to think about our patients and families as sort of that end user, and that we could get that customer feedback. And so we started doing 4, right? Providing that Disney experience I was talking about earlier. But this is about doing with. This is about creating space for patients and families to inform the work that you're doing. Now, you'll notice I didn't say to tell you how to do the work that you're doing. That's not our role. But just as our healthcare team made space for us to say, you know, I remember Stephen going in and saying, how do I go snowboarding with a PICC line in? God love our GI doctor. He didn't fall over. He talked it through with them. You know, but when we make that space, we're doing with. And so that the patient and the family's needs and priorities stay at the center. When I was dealing with when Nicholas was born, we were anticipating a healthy pregnancy. We had a healthy pregnancy. We were anticipating a healthy baby. And and he was for about a minute, and then he turned blue, and Dr. Modanlu took him out of the room with my husband following him, and returned 45 agonizing minutes later with Steve, my husband, crying, which I had never seen before, and said, "I'm sorry, Mrs. Hoy, I wish we had better news for you, but we don't expect Nick to make it through the night." In the next minute, 2 minutes, I don't know how long it was, I felt every single one of these emotions. Complete confusion. What happened to the healthy baby I was expecting? Right? A sense of amazing loss. Isolated. All of my girlfriends were having babies too. Nobody else was in a NICU. The heck was that? Right? All this cluster of emotions. I always say, you know, the stages of grief lay out really lovely on a textbook. My experience is it's a whole lot messier than that, right? So if I'm in that moment and I'm keyed up and I'm nervous as heck, how are you going to move me to someone you can engage with, right? How do you move me to a place where I'm calm, confident, and comfortable to engage? That I know I have a place in this relationship, right? It doesn't mean that I'm always right. I know there was one time with Dr. Nelson, our fabulous pediatrician, who came to me, and I was throwing a fit because Nick was in the PICU, and I had worked so hard to get him off the bottle onto a sippy cup, and I was, where are the sippy cups in the NICU and the PICU? They should have sippy cups up here, right? That was hugely important to me. She came in and she sat down with me, and she touched my arm and said, "Libby, I know that's really important to you right now, but right now we have to discuss if we should put a trach in." Okay, but what did she do? She made an invitation to me. She created space for me to move to a place where I could engage with her, engage in that conversation, right? Okay, that's one of the key features, is that invitation piece. Some of the ingredients in partnership, you can pick up on them, that I've been discussing them all the way through, but respect, okay? So when we work with direct staff or even administrative staff or policy-making staff, we always talk about respect, and how does that get conveyed? How does that work? Is it eye contact? Is it, you know, if you're in person? But at a policy level, it's about engaging that voice into the policy work that gets done, okay? To really, truly get to co-design. We worked on a project last fall about an HRET project looking at the community health needs assessments, right? That's a document that every 501c3 hospital, every nonprofit hospital in the country has to conduct or report on to the IRS to keep their nonprofit status. And so community health needs assessment, you would think they'd go to the community, right? Right? So we were looking at how many of the patient family advisory councils were engaged in that work, how many communities were engaged in that work. And we found not so many, not as many as maybe could have benefited. That process would be more relevant, more a part of the community organizing. So that respect of bringing the patient family voice in, okay? Not just relying on data, but also having the conversation, not one or the other, both. There are I think in patient family engagement, there's very few either ors, there's a lot of ands. How do you get information to patients and families? Sometimes it's electronic, sometimes it's paper, sometimes it's both, right? So be thinking kind of outline. I think the most, well, these are all really important, but we've talked about empowerment and good communication. I think it's really important in this work of engaging patients and families to be strength-based, to approach this, and this is sort of an individual choice thing, that you have to really approach this with an eye that patients and families have key information that will benefit the outcomes we're designing together. And whether you're designing those outcomes in the care relationship or elsewhere, right? But respecting that patients and families, asking first what they've done before we tell them what to do. I think the area of patient education is such fertile ground for this kind of engagement, because how do we get those messages forward in a way that's relevant and important to our communities? We have to create patient-family engagement at our community level, right? Because what we design here in Las Vegas likely isn't going to resonate in Mississippi, right? Or in Los Angeles. So we really, need to keep those levels in mind. Collaboration is also a key ingredient of patient-family center care and engagement. But I want to really dive deep onto what collaboration is. I listened to the director of social work for USC in Los Angeles, and she described collaboration as this process. And I thought, that makes so much sense, right? It's really easy to say, we're going to come together on a common purpose. We want to improve healthcare. That's easy. We can all agree on that. I want it to improve. You want it to improve. But then we get into problem solving, right? And those different perspectives come together, and they sometimes clash. They're different perspectives. That's the whole point, right? And then we get to negotiation and that co-design. So think of those cogs going around together and working together. There's some sticky points in there. There's going to be. We have to stay committed to remaining active in the process of collaboration. It's not as easy as it sounds. Collaboration, I think it's like a kumbaya word, right? It's easy. It's not. There's some sticking points, and we have to be committed to getting through those. So a lot of times, and no, that's not me. A lot of times when I talk with organizations, they think, oh, you know, we open these patient family advisory councils, they're going to be asking for everything. They want everything. I'm like, yeah, could be. I remember thinking, you know, why can't we have Haagen-Dazs on the trays every single night? I don't understand that. That would be great. Well, there's a lot of good reasons we shouldn't have Haagen-Dazs on the tray every night. The thing is, we all enter with this teachable spirit. An acknowledgement that you have information about healthcare that I don't have, but I have information about healthcare that maybe you don't have yet, and how we come together on that. And in the example that I gave you with Dr. Nelson outside the PICU, it's not about entitlement. It's not about patients and families giving them everything they want, doing for. It's about this dynamic, reciprocal relationship. It's about empowerment. How do you get to the kind of outcomes that we had thus far? Empowerment. My guys feel empowered in the healthcare system. I feel empowered in the healthcare system, right? And a lot of people have questioned, well, you're, you know, somewhat educated and you're articulate or whatever it might be, kind of write me off as being empowered in the system. It's easier for me to be empowered. Absolutely, it's easier for me to be empowered. Number one, I speak the language. But this empowerment piece, I think the one thing that comes through is that I had a voice in the system. The boys have a voice in the system. Why can't we make that available to everyone? Why can't we create that invitation everywhere? And as I found this empowerment triangle, and I just absolutely loved it because we're a sports family, first of all. But as I look at the top part, I thought, that's them. That's Stephen, Nick, and Jack. I mean, the coaches are their healthcare teams. They're all of the people that have influenced them and worked with them and heard them and denied them and told them no at times, right? That trusting relationship, that coach. You know, you think about a coach, right? They're not always rah-rah, here you go. Sometimes they're really holding the hard line. I expect this of you, right? So there's that whole relationship piece. And then the challenger being mitochondrial disease. But the really cool part, and I think you saw it in those pictures, they are the creators of their lives. They're empowered in that regard. That's what this relationship does. Conversely, if we're giving, you know, like my mom, who didn't have a voice in the system, who had procedures done to her, right? She didn't feel very empowered. She was always nervous in the hospital, like something was going to happen she didn't know about, right? It was really scary. Okay? So thinking about it in that way, engagement equals empowerment. And when I'm talking with, you know, direct line staff, I always say, who do you want to work with? The person in that chaos picture, or the one who's calm, confident, comfortable, the patient who feels empowered? Who do you want to work with? So how do we get engagement started? This is a project that I wanted to share with you. We worked on with the National Quality Forum to develop a patient passport. And the intent of the passport is that it's a document. It was actually inspired by the work of the Patient Family Advisory Council at Mattel Children's UCLA and their emergency room staff. So the families came in and said, you know, we've got kids with really high needs, and we get to the emergency room and we get backlogged. Is there some way that we can get just the basics, right? So for my family, it would be, if we're in any kind of crisis, the first thing we need to stabilize is D10. Is there any way we can get to a bag of D10 quickly? And so they created this passport, and it literally moves those patients into the emergency room a little bit faster, which results in better outcomes and keeps them safer for that period. We took this at National Quality Forum, and again with a stakeholder group with patients and families, physicians, policy makers, administrative, everybody, created a patient passport that could initiate that conversation. So a physician who's trying to look for that engagement piece, how to get started. And this passport is downloadable. You can, it's on an app. It's meant to be printed. But it's also meant to be, again, adapted at your community level. So take a look at it, see if it can help your provider population to create those initial conversations. Again, you can modify it in any way that makes sense for your organization, your population. So some strategies for engagement. I think my favorite one is asking open-ended questions. When we got started in this work, back before Epic, when everything was on paper, we sat down with a group of nurses to do an intake. And we told them, okay, put the form aside and ask 3 open-ended questions. Ask, what does a typical day in your life look like? What is your top concern? And what can we do for you? And see if you can, by those conversations, fill out your form. And by and large, we got to within 2 or 3 items that had to go back and be, you know, recognized. But what a richer way to get information and to develop that engagement, develop that partnership, right? Providing choices, I think, is a really important piece, and unbiased information. So you may be a clinician who, you know, selects a certain protocol of 80% of the time, but being willing to open and present other options as well. Recognizing that oftentimes patients and families don't have the flexibility of thinking in the healthcare environment. I remember working in peer support for years, and one of the common things of NICU moms was, well, they showed me how to clean the trach going clockwise, but then a nurse came in and did it counterclockwise, and oh my God, which one's right? I'm going to kill them if I don't do it right, right? I mean, those are the stakes that we feel. We don't have that flexibility in thinking yet, and so that's a journey in and of itself, and so we need those conversations. Using interpreters, I think the folks that make me the most concerned in healthcare are those that just nod up and down to understanding when we know clearly they haven't. So I think there's a lot of technology solutions for that as well now. Empowering and guiding your patient and family to their desire for knowledge is a really critical piece. We were so fortunate. It was a 7-year nationwide search to get the boys properly diagnosed. And during that time, the internet was very new. And I'm sure that I drove everybody crazy, but going into each of our specialists and saying, here, is it this? Is it this? Right? I remember going to Dr. Keynes at CHLA and saying, it's got to be central hypoventilation syndrome. That's what Nick has. He's like, this part fits, this part doesn't fit, go back, you know, if you're going to be part of that. He guided our process rather than saying, would you get off the internet? Or would you stop listening to Aunt Sue, who was a nurse 45 years ago? Right? Okay, so getting to be part of all of those sticky points in the relationship. Assessing knowledge of the medical condition, really hugely important. I learned that with Stephen when he was going off to college. We were having the conversation. So what does mitochondrial disease mean to you? I'm like, totally got this. He totally knows what's going on. And he said, oh, it's something we had when we were kids, but we're over it now. I'm like, dang, got some more work to do. So recognizing that understanding changes over time. And then there's some resources for you for that. So really, all of this, again, is creating that invitation and then creating that reciprocity in care, that opportunity for patients and families to inform the care plan that's being developed, to inform all levels of care, from the bedside to the boardroom. We've been talking a lot about the care relationship, and I'm going to move into the patient-family advisor role in just a minute. But before I do that, I want to really encourage you to think mindfully about your vulnerable populations. When we talk about engaging patients and families, that really needs to be expansive across the populations that you serve. I think to do that, the first thing you need to do is accurately identify the populations that you serve. So yes, look at the data, but then go out in your communities and go to your parks and go to your churches and figure out who's there, who's using your services, okay? Make those connections. Start those conversations. Most communities have such a wide and strong network of community-based organizations that provide different slices of the pie of support to patients and families in a variety of different areas. I know when I was working at the Parent Resource Center, I was blown away by how many community resources, and every community we've gone into since, that network exists. Go out and find it and make those connections in your community. That's how you're going to get to your more vulnerable populations and expand your team and your thinking in that way. Isn't that a gorgeous picture? I love that one. So I think we have a few minutes here to spend some time thinking about how do you invite your patients and families to engage in your relationship. So I'll give you about 5 minutes and I'll call you back with 1 minute to go. So talk amongst yourselves. All right. Let's bring it back up for a moment. You are such a great listener. I'm so glad you moved to the front of the room. He's my favorite. Did we have any ideas from the chat box? Okay, I'll hold.
So we got one from Laura Morgan, and she stated, I hate to say it, but all the emphasis is placed on HCAPs. And thinking that we're just getting them to understand that they will be receiving a survey and we need a 9 or 10, then that we're engaging them. She also stated in hospitals, strong volunteer can often increase the patient engagement because they aren't. She changed the screen.
I'm going to be telepathic for a second. I bet what she was thinking because they're not as pressed for time as the nurse workforce. And we're seeing a lot of that where we have patient family advisors rounding on patients to be able to give that extra comfort. That's another way, and it's a perfect segue into moving into how do patient family advisors start to impact your organizations.
And then in the room, we had talked to the patients like their person.
Because we are.
Yeah.
Just going to throw that out there.
Challenge of indirect contact with patients, telephonic contact, challenging and educating. Mm-hmm. In Utah, we had being constantly positive and optimizing technology to do that, and offer role models.
Excellent. Excellent. Those are all great suggestions for inviting patients and families in. All right. So as we move from inviting patients and families into that bedside sort of relationship or clinical relationship, we're going to move into where we can really start to look at patients and families as that key strategy for improvement. So as you think about the resources you use in your workflow to create improvement, whatever that might be, could you start to think about your patients and families as an additional resource? I have often said patients and families are the most underutilized resource in the healthcare environment. They have a perspective on your services and how they're delivered in your organization that doesn't exist anywhere else. And if we tap in and create these pathways for patients and families to become advisors and partners in improvement, imagine again what we can design. So as we look at patient engagement as an active strategy, one of the few findings we know is that it improves the quality of care, improves the outcomes, and if my voice pictures don't convince you, I don't know what will. It improves the safety of healthcare, and Cincinnati Children's Hospital puts it really well when they talk about spreading the safety net out further because we're engaging patients and families in that process. So whether we're designing a readmissions program, St. Francis Medical Center in Linwood, California did a fabulous project around reducing that readmissions, and they did it by redesigning their discharge process with patients and families included in that who had experienced the discharge process. Again, it's not them coming in and telling you what to do, it's informing your work from a perspective that isn't currently informing your work or may or may not be. So what is a patient family advisor? I've talked about that a little bit, and those of you who've had experience with them, they're folks who have healthcare experience that share those experiences or stories to represent all patients and families that are served. This is a definition that was created by a group of 25 of us, patient family advisors who were convened by the Institute of Healthcare Improvement at their forum in 2012. And what I really appreciated about that group was the diversity in it. We had cultural diversity in it, but we also had geographic diversity in it. So we had one gentleman there from Johns Hopkins. We had another gentleman from a 17-bed hospital out in Mississippi. So I feel really confident when I move this definition of what a patient family advisor does and is forward. Prior to 2012, we didn't really have a good framework to really organize ourselves on. And so some of these pieces are coming out. I encourage you to use them, steal them, take them, share them. Similarly, in 2014, sorry, just got a time check. I'm talking faster now. In the introduction, you were introduced to our Patient Family Advisor Network. We actually have more than 250 now patient family advisors serving in that role across the country. So again, geographic, cultural diversity, and now we're seeing healthcare settings diversity. So not just hospitals, but we have a couple of kindred organizations. We have QIOs, Quins, national organizations. And so we've asked all these advisors and had conversations, what skills do you bring to that advisory role? How do you create those partnerships? And what we learned was, number one, we had to have an ability to establish partnerships. So in the care relationship, we're looking for that invitation, right? The advisor role, we have to be then able to initiate those partnerships, those respectful partnerships. We want to stay constructively collaborative, so we want to present information and our experiences in a way that others can learn from and that can inform the work of the healthcare improvement. We have to stay solution focused, and this is sometimes where we lose some of our advisors because it's really difficult if they've had a bad experience or a painful experience. Sometimes it's difficult for us to move through that into being really solution focused. I worked with one organization in Los Angeles, a hospital who had a PFAC, and God loved this woman. She was fantastic and energetic, showed up to every meeting, had great ideas and thoughts, except no matter whether we were talking about parking or safety programs or a hand washing initiative, everything was the social worker's fault. And if we just got rid of the social work department, everything would be fine. Not real solution focused. So anyway. The other thing is being representative. I view myself as it's a primary responsibility of my work to be representative of patients and families that are served in whatever scope I'm serving in, whether it's at our local hospital, in our county, or in the state, or nationally. We need to recognize as advisors that our experience is unique and may or may not reflect the experiences of others in that organization. And so taking that representative voice and being in touch with the patient population that we're serving that role in is really important. And then finally, a teachable spirit, which came from a gentleman named Kai who attended one of our skills exchange, which is our preparation program for patient family advisors. And he sat in the back of the room very quietly all day, the 4 hours. I couldn't get him to kind of engage. And at the end, he said, this is all about everyone entering with a teachable spirit, understanding that you have knowledge about an experience that someone else might not have, but also there are things about healthcare that we don't know, right? And so if everybody enters this work and this partnership with that teachable spirit, we can really move forward. So we talked about engagement in the bedside to the boardroom, and this is just a depiction of kind of the different areas and different ways you might think of patient-family engagement. And the purpose of this, I'm not going to read the slides to you because you have them, but the purpose of this is to say, start where you are. What makes most sense for your organization? If that's in the care relationship, because that's where your resources are going, then start there. If it's in terms of creating a patient-family advisory council, then start in that quadrant. There are a number of different places to engage patients and families as partners in care, and you can take a stepping stone. It doesn't have to be all or nothing, okay? And so I just want you thinking about the resources in your organization, and this is really the way that we work with organizations is to meet them where they are with the resources that they have available to them and build up from there. This is about interactions, relationships, establishing that. It's not easy work, but it's not as complex as sometimes we make it either, okay? So this is one of the other things that we do is really root everything in the strategic goals of the organization. So if your organization is, for instance, this is a depiction of the journey City of Hope went on when they decided they were going to go after meaningful use dollars. They went about designing a patient portal, and that was the way they were going to get there. They brought that patient portal to the Patient Family Advisory Council there, who were able to participate in a co-design process so that they developed a patient portal that was relevant and important to the patients and families served. Unfortunately, they did that. They initially designed the patient portal, brought it to the Patient Family Advisory Council and asked them what they thought, which of course they got, well, this will work, but that won't work, or this doesn't make sense, this makes sense. God love them, they went back and spent more tens of thousands of dollars to redesign it. So we really want to get you thinking about the strategy upstream at the co-design phase, not review and revise. Some of the key messages when you're working with staff is that patients and families really are a resource to their work. Having more information is going to allow you to do your job in a more effective, impactful manner. Thinking about that, chaos slide. Do you want to work with that person who's in chaos? Or do you want to work with that person who's been moved to calm, confident, and comfortable? Right? It just works for them. So it's kind of a win-win. Research shows that engaged patients and families rate their experience higher, right? So that gets to your HCAP scores. Not as directly as teaching to the test or teaching to the questions, but it's a strategy for building that relationship so that those scores come up naturally or organically. Vidant Health in North Carolina did that, I thought, incredibly bravely. They needed to improve their HCAP scores, and they looked at implementing patient family-centered care and patient family engagement as a strategy to get them there rather than a customer service sort of linear model. And finally, that it's not more work, it's a new way to do the work that folks are already doing, again, with that added resource or tool. Some of the key messages for leadership, because we all know that nothing gets moving without leadership, so I get this all the time. Is it top down, bottom up? It's top down, bottom up, side to side, every which way you can get a foothold. Okay, and starting where you are in the organization with the resources that you have, but integrated and rooted in the strategic goals. That is such a key piece, because without that piece, it's very difficult to get leadership to buy in more than philosophically, but we need leadership to buy into patient-family engagement as a strategy philosophically, programmatically, and financially, right? This also doesn't get done if you put it on somebody's plate who's already overly committed, right? Who already has 5 job titles and says, go do patient-family engagement. We have to, just as we commit to any other resources, to learning a lean project or a process, committing to learning how to use this strategy impactfully. There's other ideas there that are pretty self-explanatory. So one other table question that I was going to put to you guys is, what problems exist in your organization right now that co-designing a solution, so bringing patients and families in as partners in improvement, might help you to move forward, might give you some information you don't currently have. So if you guys want to chat amongst yourselves for maybe just 2 minutes. All right, I know that was really incredibly short to have a conversation. But in the interest of keeping us all on track, I'm just going to bring you back, but I'm going to bring you back with the hope and even the expectation that you'll continue these conversations, because this is where the learning happens. We're all developing this together, so let's keep those conversations going across all the states. So just in wrapping up, you won't know the results at the beginning of patient-family engagement. When you start a patient-family advisory council, what did Health Insight ask me a number of times? What are we going to get from this? I don't know. I can't tell you explicitly what you're going to get. But when you start the structure and you open the door and you make the invitation, you're going to get information that you don't currently have to drive the improvement you're looking for. So get comfortable with the idea that you're not going to know what the outcome looks like at the beginning. That's the whole point. We haven't done this before, okay? Make the invitation and start today as an individual and get that groundswell going in your organizations. So thank you very much for listening, and I was almost on time.
Thank you very much to Libby for all of her wisdom and experience that she shared with us. And now we're moving into the last session for our afternoon, and that is action planning and evaluations. So now's the time for us to actually complete those action plans that we've been talking about all day. And in your book, you will see on page 11, action plan. Go through this real quick. There we go. So you will see this page, these two pages. And so keep in mind that what we're doing, you need to evaluate your experience here, but part of what we're going to do to evaluate our experience with you is not just the evaluations you're filling out, but also your input on the kinds of action that you've planned to take as a result of today. So you were introduced to some new key strategies that you can implement in your organization or facility. So think about what stuck out to you. Did you have that aha moment that Deborah talked about earlier? And you'll see at the top of the page there's some ideas for action that you could take, some ideas for how to measure what you do. But you can also jot down some of the ideas that you heard that you really liked today, or some of the people that you saw or met, whether it was a speaker or it was somebody in the audience with you that you would like to contact after today as you move forward as part of your action plan. And we know that although you might not finish your action plan today, right here in this room, we encourage you to at least take this back to your organization and finish it as well. So you can begin your action plan by answering the questions that are on page 12. And we recommend that you actually schedule a time with your team back at your facility to go through this and share with them the information that you gained from today. That's one of the things that we struggle with as people. We come to these kind of things and we hear all this great information, and then when we get back to our organization, it doesn't go anywhere because we don't have time to sit down and share it. So I encourage you to figure out a way to schedule time with your team and share the information, and then you can maybe work together with them to fully develop the plan that you kind of have in your head right now. I had the opportunity to hear a great idea from one of the people in my table. So think about, for the people that are here in the room, think about what it is that you've started to put together, piece together in your head, and share that with the people that are at your table. And for the people that are online, please share briefly in the chat box what it is that you are starting to piece together for your action plan. And I'll give you about 5 minutes to share those with each other. We'll give you one more minute and then wrap up your conversations, please. All right, so let's bring the conversations back into the group and see if anybody has something to share. And I know that we have somebody that shared in the chat. So Jennifer, would you please tell us what was shared, please?
Sure. This is from Laura Morgan. I like the idea of using the annual wellness visit as an opportunity for patient engagement. This can accomplish things like advanced directives and increasing patient portal use to get meaningful use numbers up. Focused patient callbacks is good too. Patients have said they like it.
Thank you very much. And do I have permission to share? Sure. During the brief break here, I spoke with Ryan Scott and his colleague, Rochelle, about what their plans are, and they would like to take the 3 good things back to their organization to see if they can get that spread among their colleagues. But they're also trying to figure out a plan for how they might approach building a patient family advisory council. So I think Libby will be a good resource for them in that. So whether or not you actually were able to come up with a full plan, hopefully you have at least the start of one. And so we encourage you to share that with us. You'll see on the table in front of you, or if you're online, you'll have a survey link in the chat box, or you can use the QR code, whether you're here in the room or online, to tell us a little bit about what it is that you plan to do. And the reason that we'd like to do this is we want to be able to support you. We gave you all this great information and some resources that are available to you, but we want to be able to provide you with some support to help you move forward in action. So in the next couple of weeks, a Health Insight representative will reach out to you to see how you're coming with your plan and to see what we might be able to do to help you as you move forward. Plus, we're always looking for stories about improvement and successes that we can share with each other to improve the work that all of us are doing. So our in-person participants, you can do it on the paper or use the QR code to get to an online link. And our online people can use either the QR code or the survey link. And I'll give you a few minutes to fill that out. Before you leave today, we ask that you complete an evaluation of each session that you attended as well as the overall event. We want to know if your experience today helped to improve your skills, you believe, as a change agent, and that we want to be able to improve our efforts so that our next Change Agent Learning and Action Network event will be even better. So in person, there should be an evaluation on the table, or you can use the QR code that's in your Change Agent Action Book to do the evaluation online with your mobile device. And the people that are online can either click on the link that's on the screen or use the QR code in your Change Agent Action Book. For anyone that's still interested in the continuing medical education credits, you're asked to complete the CME portion of the evaluation as well. And those certificates will be mailed to participants who mark the CME on the inline or online sign-in sheets today. So please make sure that if you want the CME credits, that you've marked that portion on your evaluation, whether it's online or in person. And if you've been here in person, you should have signed in this morning saying that you wanted the CME credits. They will be sent to you in the mail. We encourage you to watch in your inbox in December for more details about another event that we're going to be having. On Thursday, January 21st, there will be a webinar on innovative management of patients with chronic conditions and complex needs. It will be the first of our quarterly Change Agent LAN webinars. So please keep an eye on your inbox and join us in January for the LAN event. All of today's presentations are available on our website at this link, www.healthinsight.org/changeagents, and you can download all of the presentations. And I believe that the breakout for Libby Hoy was actually recorded because we had some technical difficulties. So anyone that was online and did not get to hear Libby can also find that recording probably in a week or so on our website. So thank you for coming today, and we look forward to seeing you again in the future.